Ladies and gentlemen,
this is the Dental Up Podcast, brought to you by Keating Dental Arts, a full-service, award-winning dental laboratory. Each week, you'll learn tips and techniques from real-world dentists, bringing you in-depth interviews, motivating stories, current events, and sports.
Here is your special host, the Senior Technical Advisor for Keating Dental Arts, Brandon Fetters.
Hey everybody, Brandon here. Welcome to another episode of the Dental Up Podcast. Our guest this week is a well-renowned, full-time practicing dentist whose work is characterized by his high quality and standards. He is a professor at the University of North Carolina at Chapel Hill and has been teaching for the past 27 years. Currently practicing from Greensboro, North Carolina, please welcome Dr. Jamel Odeh, DDS. How's it going, Dr. Odeh?
Doing great. I hope you're doing well, too.
Indeed, yeah. Thank you so much for being on the podcast with us. Now, I hear that you're currently in Canada. Is that correct? You're on a trip up in Canada?
It is. That's my second home in Montreal, Canada.
Oh, nice. That's great.
Yeah, I'm kind of almost semi-retired in there, so I spend a lot of time in Canada and in North Carolina.
Oh yeah. I remember a while back when you told me you wanted to be able to travel and see more of the world before you saw it from the viewpoint of a wheelchair. I was like, that one made a wrinkle in my brain.
Exactly. Yeah, I don't want to be traveling, seeing the world on wheelchair or walker.
Yeah, indeed. Now, I appreciate you coming back to the podcast with us. Just to catch up some of our newer listeners and followers, can you share some of your backstory and what encouraged you to pursue a career in dentistry?
Well, it started with my high school best friend. His father is a dentist, and he actually practiced. His office was connected to the house, to his house, and every time I went to see my best friend, I could hear the drill in there. I used to go there and peek a little bit, and then got interested, and his father kind of encouraged me to pursue that career, and that's how I got interested in.
That's awesome. And now, after you got interested in it, where did you end up going to attend school?
I attended school at the University of North Carolina in Chapel Hill. First, I did my undergraduate in North Texas University, and then I moved to North Carolina, did a couple of years of medical research at the med school, then attended dental school in Chapel Hill.
Awesome. And I see here that you actually graduated early at the top of your class. How did you get started in your career after that with owning a practice?
Well, clinically, I graduated number one clinically in my class. I did all my requirements in 3 years instead of 4 years. And in my senior year, I was given a teaching assistant at the dental school, was teaching the freshmen and sophomores.
Wow.
And that's how I got also interested in teaching.
Huh. That's
my senior year also, I did a lot of extra things in there, like volunteered in the emergency clinic. I did do a lot of endo. Went to Central Prison in Raleigh, North Carolina, and did a lot of work in there too.
That's great. Now, are you still teaching to this day?
Yes, I teach a little bit right now, not like I used to. I taught for about 27 years at the dental school. I was in the pros department, but I'd still go a little bit in there, not like I used to. I used to go there at least once a week, but now, I might go there, once every month or 2 weeks.
Gotcha. And what type of curriculum are you teaching? Are you doing fundamentals or advancements in technology? Can you share that with us?
I teach the clinical part. I usually have between 8 to 10 students, and each student has their own patient and their own case, and walk them through the case and do the procedure. But of course, I try to introduce some technology, and the school also did very well introducing some new technologies to the field. But mostly, I try to focus on the fundamentals. In my opinion, if you don't know the fundamentals, it's hard for you to use that new technology and know what you're doing.
Yeah, that's
fundamentals
so
is very important with just about anything.
Yeah,
you have to teach fundamentals.
I could not agree more. When it comes to CE courses, what are your thoughts on that? And do you attend any yourself?
CE courses is very, very important, okay? Because this is how you're really going to expand your skills and you're going to, polish your skills. Of course, you're going to be exposed to new ideas, okay, and new ways of doing things. To me, it's really the key to your success in expanding your practice. It's really CE courses, because the dental school teach you only the basics. The way I put it all the time to my students, the dental school actually teach you just to crawl. And then it's up to you to stand up and walk and run with it. Okay.
Yeah.
Then that's how you're going to run with it, with polishing your skills through CE courses and doing things.
Gotcha.
But, and definitely I do, I do CE courses all the time. Even, there's some days you learn something, there's some days you don't learn anything. But to me, it's a good thing, even if I learn one little thing. Okay, to me, that's beneficial to me.
Yeah, and almost like if you don't put yourself out there to be exposed to it, you don't know what you might be missing. So now you had mentioned about CE courses in your practice. How's your practice doing at this moment?
Practice is doing great. Just like you and I, we talked before, Brandon. I was thinking about retirement, and what I did sell my main practice, and from that proceeding of the sale, I did invest in other 3 practices in Ohio. And those 3 practices, basically, I own those practices, and they're run by a company. And, of course, I still monitor that, and I'm involved in a daily basis with all the businesses that go through those practices. Basically, what I'm doing, I'm trying to invest in myself, but I also still work part-time in my old practice. I work between 1 week to 10 days in that practice, just to stay polished on my skills.
Excellent. What kind of feedback have you been getting from your patients as this transition's been taking place at the main practice?
Well, of course, you get a mixed feeling. A lot of those patients, they still wants to be with me. And of course, that's the reason I work 10 days, about 10 days a month. And they're just, I feel like, I have obligation toward them. They've been loyal to me all those years. I need to be loyal to them too. So, of course, in any practice, you're going to find, patients that they're, die hard to you, and they don't want to see nobody but you. And of course, there's some patients, or what they want to do, just have some dental treatment. They don't care who they see.
Yeah. Well, that's true. And like you're saying about building that loyalty, that's kind of a major compliment coming back toward you also.
Yeah, it is.
Now, in a prior episode with Sean, you had mentioned that you do everything except for ortho. Do you still do all your own extractions and other procedures?
Yes, I still do all my extractions. Okay, and I would say I probably do 90% of my own extractions. But of course, I'm very careful, and I know my limitations. Of course, you need to be case select. There need to be some case selections in there. You need to know your limitation. You need to know your patient very well. That there's a lot of, not every patient will behave the same way. You got difficult patients, and you got difficult, extractions that, I don't want to handle. So it's very important for any dentist to know their limitation, not just with extractions, with any case. With the, even if you do ortho, or if you do endo, or you do, full mouth constructions and all that, you need to know your limitation. So knowing your limitation is going to help you avoid a lot of issues down the road, especially the legal issues.
Understandable, yeah. Don't want to be caught in those situations for sure. Now, have you found that patients prefer to kind of shop around and try different dentists, or stay with one dentist for a long time?
Well, you're going to find both. But I think, in my opinion, I think patients look for long-term relationship with their dentist. that's just because, it's the same thing like, with anything else. Like, how sometimes you feel very comfortable with your medical doctor and you want to stay with the same medical doctor. And the same thing for dentists. A lot of patients, I think the majority of patients want to stay with they want to have a long-term relationship with their dentist.
Yeah.
Once they feel comfortable. But of course, you're going to find a small number, in my opinion, that of course they shop around for financial reasons. And some of them, they don't care about the quality, or the quality of dental work is not that important to them.
Yeah,
but you're going to find that. But for the majority, I think patients is going to looking for a long-term relationship with their dentist.
Gotcha. Now, are there any new technologies that have been catching your attention?
There's a lot of new technology these days. I think technology is moving way too fast these days for us, and being integrated in the dental field too fast. It's kind of hard to catch up. But to me, you need to integrate the technology that fits your practice. For example, like not all dentists will do, they place implants. So, for example, if you place an implant, it's very important for you to have a cone beam or 3D X-rays in there. I also like, the technology as far as the 3D printing.
Yes.
It's also digital impressions and, scanning systems. That's very, very important these days because I think most labs moving toward that, So now, to me, it's a lot easier to have a digital impression and send it to your lab. It saves you a lot of time, a lot of money in the long run. Yes, in the initial investment, it's going to be high, but in the long run, it's going to be beneficial to you.
Yeah.
That's the same way, when digital X-rays was introduced. At the beginning, of course, was very high price. But in the long run, I think you end up actually saving a lot of money and making money off that.
Yeah, it just takes some time.
I think everything's really going toward digital these days. So it's very important to kind of integrate those technology into your practice. That way, you could. It's actually more of a marketing thing too, because I think patient is very savvy these days. They know about technology. They want technology. It's become, the world's become technologically advanced.
Mm-hmm. Yeah, now I imagine, obviously, it sounds like you have quite a few of these options at your main practice that you were selling. And going through that, I imagine you have personnel coming on with that whole transition. Have you ran into any concerns with them learning to use this technology?
Well, it takes time, for any employee to get used to some of these technologies. Mm-hmm. And it's not just that. It's also every practice, they run their practice differently than any other dentist. It's hard to find two dentists run their practices the same way.
Yeah.
So even on the daily basis, you're going to have to train your new employees and train them how, your practice run, how to treat patients, and also the technology. Mm-hmm. So I don't think it's going to be an issue. I think it takes a little time. You have to invest in those employees, and you have to invest in the way they need to become a team member with your practice.
Excellent. Now, kind of switching gears here a little bit, just because we have the Midwinter show coming up here in Chicago in a few weeks here next month. Are you going to be attending that?
Probably not. I'm trying to escape the cold weather, especially in Montreal.
Yeah.
So looking for a warm spot.
Okay. I'll have to see if I could get something booked down in Florida or something, and get you maybe even to come down here.
Okay.
Well, did you have any final words or thoughts you would like to leave with our listeners?
Well, the final thing, especially for the new graduates, I understand, these days it costs a lot of money to go to dental school. And when you graduate, you have a lot of debt that you're dealing with. And of course, as an instinct for these students, hey, I'm going to try to pay off my debt in there. So to me, And of course, what's going to happen in there, some dentists, they're going to try to oversell their product. My philosophy always been one thing, that you treat people the way you want to be treated.
Yeah.
Okay? And try not to oversell your product, because, patients these days, they're very savvy, they're smart, and, you treat them well. Once you treat them well, I think patient will trust you. Once you gain their trust, you don't have to be a salesperson. I'm one of the worst salespeople that you ever meet. I just do the right thing for my patient. And once you do the right thing for those patients, it's also, you're going to benefit a lot from referral. Mm-hmm. They're going to refer to you their friends, their families, and their neighbors. To me, word of mouth, it's a lot better than your advertisement on Facebook or any social media or anything else. So treat people the way you want to be treated. And also in the same time, like I said, try not to oversell. And the final thing for any new dentist for down the road, basically try to invest in yourself and invest in your future. What I mean by that, dentistry is very physically demanding, mentally demanding, and that's why most dentists, they practice 3.5 days or 4 days at the max. And so what I did, I invested in my future. I invested in my 401k. I saved a lot of money. And then I also invested in real estate. So in order for you to continue living the same lifestyle, invest in yourself. Pay yourself first before you pay Uncle Sam.
Yeah.
So investing in yourself, investing in your retirement early on in life, that's very important. To me, that's more important to start with. Instead of buying a Porsche and then go ahead and buy something else that is going to benefit you or pay you later on. So that's very, very important. Invest in yourself.
Excellent. Well, Dr. Odeh, thank you so much for taking your time to meet with us today. That was absolutely great. Always love talking to you. Once again, thank you so much.
My pleasure, and as always.
All right. Take care. Have a good one. Bye-bye.
The same to you. Take care. Bye-bye.
Thanks for joining us on the Dental Up Podcast Show this week. Make sure to follow us on Facebook, Instagram, and Twitter, or search the Dental Up Podcast on iTunes for our weekly feed. Don't forget to visit KeatingDentalArts.com/promo for exclusive offers. Keating Dental Arts is a full-service dental laboratory, and we're nationwide. We'd love for you to send us a case so we can show you the Keating difference. If you dig what you heard, please leave a review on iTunes, and we'll be back next week.